India and Maldives share a close relationship. They have forged a close partnership. With me is Indian envoy to Maldives to talk about partnership in the times of COVID crisis. Welcome to Wion. My first question to you is, how is the Indian mission reaching out to the stranded Indians there at a time of COVID crisis? And also, we've heard about evacuation process due to start. The mission has tweeted about it. Can you talk us about that as well?
Sure, Siddharth. The Indian community, of course, is a very high priority for us. In Maldives, we have about 27,000 Indians, mainly in the hospitality sector, medical profession, as well as the education profession. Of the total 550 cases, there have been about 54 Indians who have tested positive. Fortunately, they're all in good health. We maintain very close contact with the community, mainly using social media, including Twitter, Facebook, WhatsApp, and there are a lot of Viber groups in the community. We try our best to share practical information, authentic information on how to deal with COVID and other evacuation-related information. I have myself given out 2 video messages to the Indian community. We have also set up helplines where people can call freely and speak in multiple Indian languages. As far as the positive tested Indians are concerned, we have sent out care packages, which contains a lot of essential things which can at least mitigate the difficult times which our Indian friends are going through. We've also made arrangements for food for those who have lost their jobs and are finding it difficult to fend for themselves. We are providing medical assistance, including essential medicines, sanitary pads, etc., for the stranded tourists. We have been able to prepare a complete database of Indians who want to go back to India. And you mentioned about the evacuation. I think it's already come out in the news. We will take help of Indian Navy ships, the first of which will arrive 2 days from now, and then around midday on 8th of November, the 8th of May. The first group of about 700 Indians will set sail back home, back to Kochi. And then that will be the first lot. After that, we are planning a few other evacuations through Navy ships.
So, talking about the continuation of the partnership, we know that India had launched Operation Sanjeevani. We have helped Maldives when it comes to medicines. So, if you can elaborate when it comes to how India is helping Mali at a time of COVID crisis.
I think cooperation on the COVID front has been characteristic of our relationship, the way we have been working with each other at almost all times in our history. The first thing we did was, in the context of COVID, was to evacuate all the 7 Maldivians from Wuhan. Actually, Maldives was the first country whose nationals we evacuated from Wuhan. Our 14-member rapid response medical team was here for 10 days in March. Again, Maldives was the first country where we sent a medical team. We also gifted about 5.5 tons of COVID-related and other essential medicines to the government of Maldives. Operation Sanjeevani, you already mentioned, that was a very challenging operation which we could accomplish with the help of IAF. One IAF aircraft C-130 picked up a huge amount of medical consignments from 4 Indian cities and delivered that to Mali. It was about 6.2 tons. This was done on April 2nd. We have also facilitated a continuous supply of essential food items and also commodities like cement, so that the construction sector does not suffer here. We have been facilitating evacuation flights for Maldivians, facilitating cargo flights. There has also been some digital video conferences between trade officials, health officials, and as we speak, a series of 3 video conferences between top doctors of AIMS and top doctors in Maldives is currently going on. Actually, the first of the series happened only yesterday. Within a week's time, we'll also be gifting about 580 tons of essential food items, including wheat flour, eggs, sugar, rice, potatoes, and onions to the government of Maldives in these very testing times. And also, we must remember that this happens to be the holy month of Ramadan. On the economic front, government of Maldives has taken a big hit because of the hit to the tourism industry, as well as to the export of fish. We are trying to, and this has all led to a bad liquidity situation. So we have provided $150 million worth of currency swap under the bilateral agreement which we have. This actually happened just a few days back. It happened on the 27th of April. So we have been trying our level best to provide whatever assistance we can to the government of Maldives in these very, very difficult times.
Mhm. Talking about cooperation under the SAARC umbrella, because we know that the Indian Prime Minister Narendra Modi had taken this initiative of SAARC video conference, after which there were follow-up meetings when it comes to agriculture or the commerce officials. So how are both countries cooperating under that umbrella, and also how they are making sure that other countries in the region also come together for this joint SAARC strategy, which was in fact envisioned by the Indian leadership, by the Indian Prime Minister Narendra Modi?
I think you have rightly mentioned that Prime Minister Modi has championed a regional approach to combat tourism. Perhaps that is the most sustainable way in which we can handle a pandemic kind of situation. In the digital video conference which PM initiated on March 5th with heads of state and government of SAARC countries, India had announced a COVID emergency fund of $10 million. And I think Maldives has been the first and perhaps the largest beneficiary of this fund so far. Maldives, on its part, also pledged $200,000 for this fund. Prime Minister had actually initiated some kind of a viable framework for joint cooperation between SAARC countries to combat COVID. There was also a digital video conference initiated by the SAARC Disaster Management Center in Gujarat with all the other countries, in which how to deal with this disaster could be discussed. And that, I believe, was a very successful video conference.
Mm-hmm. Talking about the ground situation as well, sir, how has been the ground situation in Maldives? How difficult it has been, or perhaps easy also, and also for the Indian diplomats as well, because Indian diplomats are on the forefront of this crisis, leading all the way through making sure that the Indian community is safe, and also the biggest repatriation process, which is also begin to start very soon. So, about the situation both ways for the diplomats as well as on the ground situation.
I must say that the government of Maldives has been trying its level best. President Soli has himself led the charge in this big challenge. For a long time, they were able to protect Mali. For a very long time, actually. It was only on 15th April that the situation changed when the first person tested positive in this capital city. And after that, you can imagine that in a city as congested as Male, it's very difficult to contain the spread. And now, unfortunately, it has reached the level of community spread. But I think things have plateaued out. Of the 550 odd cases, majority are foreigners. It all started with foreigners, and even now, if you look at Mali, it's all majority foreigners. Actually, half of the numbers is Bangladeshis, because there are a lot of Bangladeshi workers in Mali. Government is working on a war footing to contain the spread and create new isolation facilities, but it's a Herculean task, I must say. For us at the High Commission, it has been a testing time. We are working overtime to take care of the community and at the same time provide assistance to the government of Maldives. You rightly mentioned that this has been the largest evacuation operation ever globally, as well as for Indians in Maldives. We have roped in some volunteers from the community, and I must acknowledge that help has been very, very forthcoming. We have full backing of our government, which makes our task much less formidable. But these days, we are working day in and day out on the evacuation exercise, and we are really looking forward to 8th of May, when the first lot of Indians will return back home to Kochi. And then we will subsequently plan other rounds of evacuation in the days and weeks to come.
Mm-hmm. So my last question to you is about the COVID containment models. Have we shared any Indian COVID containment models with the Maldivian government, how we are going about, because submissions are globally talking about the Indian best practices with their respective counterparts?
Yeah, we have done that. We've done that. Actually, as I had mentioned, the Indian Rapid Response Medical Team was the first to visit Maldives. I mean, it was the first for Maldives as well as for Indian team to visit any country. And that team came here with the protocols which were in practice in India at that time, including the protocol developed by AIMS. The medical team also helped in setting up facilities in outlying islands. And as we speak, a digital video conference between senior doctors from AIMS, including Director Dr. Randeep Guleria and very senior cardiologist Dr. Ambuj Roy, has been taking place. The first session took place yesterday, where the Maldivian side was led by their Minister of State for Health, who himself happens to be a medical doctor, Dr. Shah Maher. In this discussion, I'm told that several containment models and approaches have been discussed, and we will certainly continue following up on them and sharing best practices.
Thank you so much, sir, for speaking to Wion, talking about how the Indian mission is taking a lead when it comes to the Indian community or the repatriation process, or making sure that Male and New Delhi come together at a time of this global crisis. The word from Delhi, of course, is that, sir, stay safe wherever you are, sir.
Thank you very much. And you too, stay safe wherever you are. Thank you very much.